The folk wisdom often says, when a tree withers, its roots dry up first. When a person ages, their legs show it first. The health nourishment revelation of Granny Zhang in her 70s. Granny Zhang, who is in her 70s, has gradually noticed a degenerative trend in her physical functions over the past 5 years. The decline in the mobility of her lower limbs is particularly significant. In daily walking, she feels as if she is carrying a heavy load. When climbing stairs, she is often accompanied by numbness and stabbing pain in the soles of her feet. At first, she always attributed these symptoms to the change of solar terms, believing they were just ordinary joint discomfort and didn't pay enough attention to them. It was not until one day, during a stroll in the community, that her thighs suddenly lost their supporting force and she accidentally fell and sat on the bluestone path. This accident caused a hip injury. Fortunately, neighbors who were doing morning exercises came to her rescue and rushed her to a Class I grade A hospital for diagnosis and treatment. After a systematic examination by orthopedic experts, she was diagnosed with a femoral neck fracture and needed to stay in bed for a long time for rehabilitation. Lying in bed, Granny Zhang deeply regretted it. If she had paid attention to the initial warning signs in a timely manner and had an early professional medical evaluation, she might have been able to avoid this health crisis. Against the backdrop of an aging population structure, the decline in lower limb muscle strength has become a common health hazard. This problem not only restricts the autonomy of daily activities but also adds multiple safety risks. How to scientifically strengthen the lower limb functions and reshape the stable gait of the elderly has become an important topic in contemporary geriatric medicine. Research by the World Health Organization shows that there are more than 300 cases of deaths caused by falls globally every year, and more than half of the victims are elderly people over the age of 60. Epidemiological survey data in China indicate that the annual incidence of falls among people over the age of 65 is about 16. And there are 8 deaths per 10 people due to falls. The fundamental inducing factors are often closely related to the loss of bone density. Such changes in bone mass not only increase the probability of falling but also significantly increase the risk of fractures, especially in cases of proximal femoral fractures. About 1/5 of the patients face a life threat, and more than half of them are left with permanent functional disabilities. Exploration of the main causes of the decline in lower limb functions. 1. Sarcopenia syndrome. It is characterized by a decrease in muscle mass and the degeneration of muscle fiber functions. Clinically, it is manifested as a decline in muscle endurance, abnormal distribution of body fat, and a tendency to fall repeatedly. 2. Double decline in metabolism and immunity. The slowdown in metabolic rate and the weakening of the immune defense mechanism that occur with aging jointly lead to a decrease in limb mobility. 3. Local organic lesions. Local lesions such as plantar fasciitis and degenerative changes in the knee joint require targeted medical intervention to maintain lower limb health. Key nutrients for maintaining lower limb health. 1. Complete protein supply. As the main component of muscle fibers, it is recommended to intake 1.15 gkg of high-quality protein per day. Preferred sources include poultry breast meat, deep-sea fish, fermented soy products, and whey protein. 2. The 2 key electrolytes, potassium and magnesium, work together to maintain neuromuscular conduction. It is recommended to supplement them through natural food sources such as avocados, kale, and pumpkin seeds. 3. Sunshine vitamin. Vitamin E3 plays a decisive role in calcium absorption. It is recommended to supplement 801,000 IU per day. In addition to moderate sun exposure, sardines, fortified dairy products, etc., can be consumed for supplementation. 4. Bone protector. For people over the age of 50, it is recommended that the daily calcium intake should not be less than 1200 mg. Preferred calcium-rich food sources include low-fat cheese, sesame paste, Chinese kale, etc. Moderate exercise to maintain joint vitality. Carry out progressive stretching training in the morning. It is recommended to follow the 3 degrees principle. Increase the range from small to large. Increase the intensity from light to heavy. Adjust the angle in multiple dimensions. This training mode can effectively improve the elasticity of the fascia, improve joint mobility, strengthen the coordination of the core muscle groups, prevent postural compensatory injuries. It can also prevent blood vessel blockage, accelerate metabolism, improve the body's immune function, and help reduce venous obstruction and bladder blockage. It can unblock the kidney meridian and nourish the kidneys. However, when doing stretching exercises, appropriate methods and intensities should also be noted. Incorrect methods may instead harm the body. 1. Do not stretch suddenly and vigorously. This is likely to cause unpredictable physical injuries. Stretching should be carried out slowly and gently. 2. There should be no pain when stretching. A slight soreness is normal, but if you feel pain, you should stop immediately. This may be an alarm signal from the body, especially for the elderly. Extra care should be taken not to overstretch. 3. The following types of people should not stretch casually. For those with poor cervical spines, severe osteoporosis, those who have just been discharged from the hospital, or those who are not suitable for large amplitude movements, it is not recommended to stretch rashly. These actions may aggravate the condition and should be avoided at all costs. Identifying the signals of leg aging is crucial for taking timely preventive measures. The following manifestations in the legs may be signals of aging and should be watched out for. 1. Muscle atrophy and weakening of strength. With the increase of age, the muscle tissue of the human body gradually decreases, and the muscle fibers become fragile. This will lead to a weakening of the muscle strength and endurance of the legs. Daily activities, such as going up and down stairs or walking for a long time, become more difficult. Muscle atrophy may also cause the appearance of the legs to be flabby and weak, which is an obvious signal of aging. 2. Joint problems. The aging of the legs will also cause the gradual degeneration of joint cartilage and synovial fluid, leading to joint pain and stiffness. This situation is most common in the knees and hips, seriously affecting the flexibility and comfort of daily activities. 3. Varicose veins and edema. The aging of the body will affect blood circulation, especially the function of the blood vessels in the legs may be impaired, leading to varicose veins and edema. Varicose veins are manifested as the dilation of leg veins, accompanied by pain or itching. The edema is manifested as swelling and a feeling of heaviness in the legs. 4. Osteoporosis and susceptibility to fractures. Aging will affect bone resorption and development, leading to osteoporosis, especially in the leg bones that bear heavy pressure, such as the hips and knees. Osteoporosis will cause the bones to become fragile and increase the risk of fractures. 5. Unstable gait and decline in balanceability. Aging may affect the functions of the leg, muscles, and ligaments, leading to changes in gait and a decline in balanceability. This not only increases the risk of falling and getting injured but also seriously affects the quality of daily life. Middle-aged and elderly people should often eat 3 things to have strong legs and a good body. 1. Nuts. Nuts are a kind of food with extremely high nutritional value, rich in essential fatty acids, high-quality protein, vitamin E, and minerals such as magnesium and potassium. These nutrients are crucial for maintaining the health and vitality of leg muscles. The healthy fats in nuts help reduce inflammation, improve blood circulation, and reduce the risk of leg pain and stiffness. 2. Deep-sea fish. Deep-sea fish such as salmon, black carp, and cod are excellent sources of omega-3 fatty acids. These fatty acids are crucial for heart health and also have direct benefits for leg health. They can help reduce joint inflammation and leg muscle fatigue, while promoting blood circulation and preventing the formation of blood clots. In addition, deep-sea fish are also rich in vitamin D and calcium, which help maintain bone health and density and prevent osteoporosis. 3. Green leafy vegetables. Green leafy vegetables such as spinach, kale, and broccoli are treasure troves of vitamins and minerals, especially calcium, iron, potassium, and vitamin K. These nutrients are crucial for maintaining bone health and optimizing muscle function. Vitamin K is a key factor in helping calcium absorption and transporting it to the bones, while potassium helps maintain electrolyte balance and normal muscle contraction. The weakness of the legs of middle-aged and elderly people is not irreversible. Through reasonable nutritional supplementation and moderate exercise, we can all regain strength to walk. Let's start now. Pay attention to nutrition, stick to exercise, and enjoy a healthy and happy old age.